Diazepam, common trade name for that is Valium. It is a benzodiazepine. It has sedative and anticonvulsant properties to it. The mechanism of action acts on the GABA receptors in the nervous system, causing central nervous system depression. And what you get for that is amnesia, sedation, raised seizure threshold, and then muscle relaxation. It is pregnancy class D, and it is especially harmful to the fetus in the first trimester, so that's why you want to avoid that there and avoid that with the pregnant ladies. Indications: severe anxiety, seizures, sedation, and chemical restraint. Some contraindications for it: narrow angle glaucoma, myasthenia gravis, and then respiratory depression, coma, and head injury. Of course, you don't want to give it for those that are already in coma or depressed like that. Some adverse reactions: anything that goes along with central nervous system depression, you're going to get all that. Respiratory depression, you might have some bradycardia, any of those. I mean, you can list them all out. Hypotension, reflex tachycardia is possible, not as likely, but it is possible. And then nausea and vomiting is also possible. Some drug interactions. It is incompatible with most other drugs, so again, use separate IV or flush well between meds, which you should always be flushing well between meds. Dosage. Standard sedation dose is about 5 milligrams IV or IO, and then you could use 10 milligrams via IM. For anxiety, start with 2 milligrams typically, and then work your way up for anxiety. For the kids, 0.1 milligram per kilogram, either IV, IO, or IM. Onset is usually within a couple minutes if you're giving it IV, and with most IM drugs, it takes about 15 to 30 minutes to start working. Peak effects, 15 to 30 minutes usually, and then it lasts in the system 20 to 50 minutes, depending on the person. So something to keep in mind with Valium: it is very good for seizures. It is very good for seizures and muscle relaxation, but midazolam or Versed is usually better for sedation purposes. So I personally like Valium for seizures, and I prefer Versed for sedation, and I prefer Ativan or lorazepam for anxiety. Those seem to work pretty well like that.